Hello, everybody. Thank you for being here with us. And I have the great honor of introducing Sara Spriggs from Access Women's Health Justice and Amy Everett, who is the State Director of NARAL California Pro-Choice. Yay. I'm going to ask them a couple of questions and then throw it open to all of you. And I just want to say, first, I'd love to hear from your two particular points of view how, and I just want to say a second that Amy, I want to say a bit about pro-choice California. California is really one of the leaders in reproductive rights, and under Amy's tenure at NARAL Pro-Choice California, California has been the only state to regulate the anti-choice crisis pregnancy centers. And Sara's organization, Access Women's Health Justice, is an amazing group that is really in the trenches, hands-on, helping women over the barriers to get all sorts of reproductive and sexual health access that a lot of times I feel we don't even realize those barriers are there in California, a pro-choice state. So what I want to do is throw it to each of you because I'm curious, coming from your point of view, really in the trenches, how does this film play, or what does this film mean or matter? I guess I'll just start with you, Amy.
Well, thank you, and thank you for showing this film and inviting me to join you. This film evoked so many different reactions in me while I was watching it. I've watched it twice now. I think overall, one of the most impressive things that this film achieved is I was blown away that every single woman had her name used and had her face. I have watched a lot of abortion documentaries, and usually you just see women's feet. And so I'm really amazed and impressed with the directors for being able to make women feel so comfortable, and that all the women felt so comfortable sharing their stories, because stigma is probably is probably even worse than the laws that are on the books today, because that is internalized and we do it to ourselves. Laws can be overturned and they will be overturned, but we have to bring our culture and ourselves along on that journey to stand up and be proud of whatever choices we make at whatever point in our lives that we are. So I thought that this film was a super powerful documentary of how complex it is. For some, it's a relief. For some, it's a difficult decision. I think it also did an excellent job of talking about the impact that these laws have on real women's lives. So I'm happy to explore more, but those are just my initial thoughts.
And I think the film did a really wonderful job of showing how complex and how different all of the abortion experiences are. There is no one abortion experience, and people's emotional reaction is so different and can be so complex, and you can have the whole spectrum of emotions within one abortion experience. So I think it did a good job of showing that the political dichotomy of pro-life and pro-choice is really a false one when it comes to people's lived experiences.
That's really interesting. Amy, can you give us an overview of where we stand legally in the United States right now, briefly? Where are we at on abortion rights?
Sure. So let's just be all thankful that we live in California for any of the women that we know in our lives. So since 2010, during an epic election year when we lost, I think it became a total of 30 state governments. So both the state houses and the governor became anti-choice. And at that moment, that was the session where all of these, what were once considered really crazy laws started to become actual laws and actually impacting women. We've had more anti-choice laws introduced and passed in the last 6 years than the combined 30 years before that. So in most states, there are waiting periods. In most states, there are what are called trap laws that are just designed to regulate abortion provision. It's not really designed to regulate abortion provision. They're actually designed to put abortion providers out of business. So for most women, they have to travel long distances, they have to wait, they have to be read these ridiculously inaccurate statements about the dangers of abortion, which are factually and medically incorrect. This is true in most states. But what we also know, so I'm not just going to be depressing about where we are, I want to tell you why I am so hopeful, especially right now. Every time over the last few years that we have brought the issue of abortion directly to voters via ballot initiative, whether that is in South Dakota or in Mississippi, or in Colorado, or North Dakota, very conservative states, every single time we have won. When people, voters, are confronted with this idea of, do I really want to make abortion illegal in my state? The answer has always been no. We took some of that information and we did some messaging about it, and this sort of relates to what we were both talking about stigma, is 7 in 10 Americans actually support reproductive rights. I'm not going to say 7 in 10 Americans are pro-choice. I'm not going to say 3 in 10 are pro-life, because those labels don't mean anything when you're making a decision about your life. But what we tested in all states, we've tested it in conservative states, is that when we ask people the question, do you believe that regardless of how you might personally feel about abortion, or even if you think it's morally wrong, do you think that government should stop you from accessing care? That's when the answer is no. So that is why I'm hopeful right now. It's why when I look at election years, kind of like the one we're in, I am hopeful that this message can get out about what it means to live in a country full of freedom and dignity and respect for women, because when they are faced with those questions, voters actually vote the right way, in my opinion. And now we just need to make sure their representatives actually start to reflect them.
That's really interesting. And Sara, what I'm curious, I'd love you to share with the crowd here what I've learned by perusing your website about what the real barriers are to women in California and what your organization is doing and what people might get involved in doing to overcome those barriers.
Yeah, I mean, we are lucky in a sense in California in that we have progressive laws, and Medi-Cal, for example, does cover abortion care. But the barriers are so numerous and the state is so big. So to give a little context, what Access does, we have a hotline that people can call to ask any sexual or reproductive health related question, but most of the people who call are seeking abortion care and don't have access to information or the logistical stuff they need to make it happen. So we help people figure out how to get it covered or find funding. And then we do support with transportation, housing, childcare, translation, all of the other things that are very real barriers to care, like you saw in the film. So actually, I noticed so many similarities. We talk, I think, a lot about what we have here, but the state is so big. The clinics are concentrated in urban areas, especially the Bay Area and LA. I mean, if you're in the Central Valley and you don't know where a clinic is, that abortion is covered, and you don't have a ride or anyone you can ask, it might as well be that abortion is illegal. So, I mean, we do work with people on the ground to make sure that they can get access to the care that they need, but even then, there's so many folks that we're missing that I know that we're not reaching. So, and then there's barriers even within our little bubble here in the Bay Area. The impacts of gentrification we're really seeing as our volunteers have left San Francisco, so it's more difficult for us to find people to house people who do travel to San Francisco to find care. In the past, we could just send out an email and instantly have a place for one of our callers to stay, but now after taking Greyhound, from Lake County or Humboldt or Fresno, they then have to take BART and Muni and another city bus in Oakland just to get to the volunteer's house. Never mind trying to find childcare in their community or paying for meals and things like that. So there's just so many barriers that, yeah, it's real.
Well, that gives me a lot of ideas about the one new thing I can do each week to get into more action. I'd like to open it up to questions or comments from anyone in the audience, and I think we've got some microphones going around. Yes, and while, okay, we got one?
Yes.
Okay.
Towards in the back.
Ramsey Clark once said something like, a right isn't something the government gives to you, it's something that no one can take away from you. And so with that in mind, I just want to correct a very small error at the beginning of the film we just saw, which was excellent, which is, it said that in 1973, the Supreme Court, quote, gave women the right to abortion. Well, the Supreme Court did not give the right to abortion. It recognized that the right already existed. At least that's how I feel about it. Thank you very much.
Okay, we have another question right here in front.
I like the way the film was made. First, the film told what you were going to tell, and then you told it, and then you told what you told, right? It's a very simple, wonderful, easy structure. And so congratulations on that. And the other thing is you showed all points of view, which was very brave. And I heard there's X number of women who have had an abortion, and what is that figure?
Studies have shown that 1 in 3 American women will have at least one abortion before they're 45, and that 6 in 10 of the women seeking abortion are already moms. And so, to me, those are 2 really powerful figures, because when you look at the way our culture portrays people who access abortion in film and television, they are predominantly white, they are predominantly young, they're predominantly well off and can afford abortion care. And I think that creates an image in people's minds. They're not thinking that when women and families access abortion care, that they're actually making parenting decisions, not only about themselves as parents, but parenting decisions for the kids they already have.
The next question's to your left.
I thought you did a great job of portraying the fact that this isn't a black or white decision. This is, people approach this from all different points of view, et cetera, and there's nothing right or wrong. You have the right to make a decision. So I congratulate you on that. I was interested in terms of finding all of the people and they're getting them to say, yes, I'd like to appear in this movie, or I'm happy to appear in the movie, or however they characterized it. How did you find all of these women?
Well, unfortunately, the filmmaker, Tracy Dros-Tregos, was unable to be with us today. So we can't really answer that question. We'll have to go on to the next one.
I do just want to say that, so I have spent many years answering the calls on the hotline at Access in Oakland. I've spoken to many people who they themselves say they do not believe in abortion, who are seeking abortion care. So pro-life women seek abortion care, people of all faiths seek abortion care, Catholics get abortions. So again, I just want to highlight that the pro-life, pro-choice dichotomy is something that was kind of like invented to serve someone else's agenda, and it doesn't really reflect people's lives.
To actually address your question, I haven't talked with the makers of this film, but on other films we've worked really closely with the documentarians, and they approach the clinic owners and ask if they can film, and then they ask every woman who they want to film for permission. So it's kind of an on-the-spot situation, and I'm sure that a lot of cultivation and time and relationship building went into this film because, as I said, most women do not use their name or have their faces shown.
Okay, the next question comes from over here on your right.
Hi, I'm old enough to remember the bad old days before Roe v. Wade. And I actually worked in an abortion referral service in New York City when it was the only place in the country you could get an abortion. And, you know, I want to echo what you said about all kinds of women. We saw many women who were actually, many young women brought there by their God-fearing parents being forced actually to have abortions. And, you know, we were like 21 and 22 and had to actually isolate the woman from the pressure of the parents and give her actual counseling and present all the options to them. But one thing I didn't see in this movie was there was a reason for Roe v. Wade, is that women were dying before abortion was legal. And I'm wondering if there's any, if anybody is tracking the number of women who have been cut off by access, you know, the effect that that's having on women's lives.
Yes. In particular, actually, UCSF and Answer and the IBIS Reproductive Health Group are doing a lot of research. Dr. Dan Grossman has been, especially in Texas, where we had the passage of the bill HB2, which was the bill that Wendy Davis was filibustering, and it is the most recent Supreme Court case that got heard. In the process, once it got passed, Dan and his research team was able to go in and actually track how many clinics were closing, how many women were losing access, and what did those women do when access was cut off. And while I don't think that they were recording deaths, they were recording the increased number of women who were self-aborting. They were, and even then it was way above the national average, and that was just the reported incidences. So that is, and that was actually cited numerous times in the whole Women's Health versus Hellerstadt case, was the research that was being done about the actual impact on women.
We're also seeing more people doing self-inducing abortion by buying abortion pills online, or sometimes crossing the border into Mexico and buying them there. And like Purvi Patel was charged with feticide for doing that. So there's more criminalization as well of people who are attempting to self-induce.
Next question's over towards your left.
Yes, I was thinking the same question the other lady said about remembering the deaths of so many women before Roe v. Wade. But I was wondering about the exposure of the hypocrisy of these so-called pro-life groups who, in my experience as a former rehab counselor trying to get help from every corner for the already born, there was a bits and pieces in the film of you know, just calling out the hypocrisy. The man who was spewing all the Bible verses and asked, have you gone down to the, you know, city offices to lobby for the already born? Of course, but how much exposure of the hypocrisy? Because in my experience of decades working to try to get social services for my needy single mothers and their children, especially safe, reliable, bonded child care, I never once not only got help, but also became aware that they had no referral sources, they had no knowledge of how to help the already born.
So I think the question is, because I've had that question, how do you two deal with the opposition? How do you deal with it emotionally? How do you recommend we deal with it emotionally and on a practical level?
Humor is very important at these moments. But beyond humor, it is actually one of the critical campaigns that NARAL actually runs, which is holding people accountable for what they say and what they do. If they're going to stand up and talk about family values, well, they actually have to walk that talk. We are constantly exposing via social media or in the media or making videos about legislators, both at the federal level and at the state level, who are trying to protect women's health, which is how they frame what they do, with conversations about how then they are undermining the ability of families to actually prosper. We have had an enormous amount of success talking with people, going door to door, literally, in states, asking them to buy into an agenda for reproductive freedom for the 21st century that basically says women should be able to access birth control, they should be able to access abortion care, they should be free from pregnancy discrimination and criminalization, and we need paid family leave. Because if we're going to talk about supporting women and families, we need the policies that actually support women and families. It is, it's the one area I think that needs to be ramped up even more, because one thing I have found in my years in the movement is that people do hate hypocrites and they don't like liars. And when you expose them, you can beat them. And we have done that successfully electorally in many states, and we are now doing it at the doors of people in places like Iowa.
Yeah, that's a tough question. I think for me it's about strengthening our movements and really making sure that we have real intersectional movements that center the voices of marginalized people, and being critical of our own rhetoric sometimes too. Ending the stigma against teen parents, for example, and being really supportive of young parents. Making sure that we have social services so that people who want to parent are able to do so with real economic support, working against police violence, all of these things that really impact people's reproductive lives. So I think the smarter and more compassionate we make our own movements is the best vaccine against our opposition.
Okay, so now we're going to move this conversation into the lobby. Amy and Sara are going to join us out there. They've got us set up for a new film. And there are some wonderful handouts to take with you that give you ways to connect with these two organizations and other organizations doing the work. Thank you so much for coming.
Thank you.